how to do a Kegel. That's right. Now, my personal bias is that I really feel the best way you can learn how to do a Kegel is under the guidance of a skilled physical therapist, pelvic floor therapist, or other healthcare professional who's had training in this and who knows what they're talking about. But let's face it, that's not the situation for everybody. So in this video, I'll be talking about what is a Kegel, how to do one correctly. So first question, what is a Kegel? Basically, a Kegel is just a voluntary contraction of the pelvic floor muscles. Now, something that isn't really told to you guys is that doing a Kegel for a man is different than for a woman, because the muscles a man needs to activate in doing a Kegel are a little bit different than in women. And guys, it's the muscles in front of the pelvic floor. Basically, most of the muscles are right underneath the base of the scrotum and the penis. Those are the muscles that you need to activate and you need to be able to contract in order to do a male version of a Kegel. So how do you do that? Well, I have a few cues that you can try. Some are pretty basic, some get pretty funny and a little weird, but all of them actually have been proven to get these muscles working and get a good contraction the right way. Now, one of them is going to work better for you than the rest. Once you find that cue that works for you, go with that and use that in your strengthening program. Ready? Number one, usually the most popular one, is very simple. Pretend you're stopping the flow of urine. So what you're going to do is tighten or flex those muscles in front, right underneath the penis. Once you do that and you do that flexing, you'll see and feel a tightening of the muscle there. You'll also notice that the base of the scrotum and penis will raise a bit and retract a little bit. That is perfectly fine. In fact, that's your visual cue that you're doing it correctly. Cue number two. Pull the turtle's head back into its shell. Get what I mean? Pulling the turtle's head back into its shell activates those muscles there at the base of the scrotum and penis and helps them lift up and retract slightly. That's the exact motion that you need. How'd that work for you? All right, cue number three. Nuts to guts. Yes, I did say that. Nuts to guts. It's an upward motion and it activates those muscles, again, the right way. Now remember, when you are tightening the pelvic floor, it's not really a squeezing motion. It's more of a tightening and lifting motion. Unlike female Kegels, men need to focus on the front part of the pelvic floor to be able to strengthen those muscles appropriately. So the cues are a little different, but the movement is still tighten and lift. The advantage that you guys have over us gals is you can actually see if you're doing it correctly. You can get really good feedback if you use a mirror or if you use your finger and actually feel those muscles while you're trying to contract them. Have you found the cue that works best for you? Great. If none of those worked, that's okay. Keep trying. You might find a cue that works better than any of them. I would love to know that. So if you just hit a comment and let us know, that's going to help a lot of other guys do this successfully. Now, how do you really know if you're doing it correctly or if you're doing it wrong? Here's some of the most common mistakes guys will make when trying to do a Kegel. The number one mistake, you're putting way too much effort into it. This is not a 500-pound bench press. It's a subtle movement. These muscles are small. and so they don't contract like your quads or like your biceps will. So try not to give an all-out effort, because sometimes it actually makes things worse. Subtle movement. You're just going to feel a little bit of movement, and that's okay. So if it feels like it's a little too much and you're giving your best effort, I want you to back off at least 25%. Try it again. You might find that you can feel those muscles moving a lot better. Second most common mistake, holding your breath. That's not going to help the pelvic floor work any better. In fact, it kind of messes up that piston movement that we had talked about in previous videos. So use the exhale. Exhale as you tighten and lift that pelvic floor. Inhale as you relax. We'll go into more detail of that in further videos, but just remember, no breath holding. Third most common mistake, sucking in your stomach. Do not suck in military style. That's not going to help the pelvic floor. That's just engaging the upper abdominals and not helping your situation. So try not to suck in your stomach. Fourth most common mistake, trying to inhale when you're doing your Kegel. Again, that's opposite of the piston system that's going on in your body and is just not helping the pelvic floor. In fact, it makes it more difficult for it to work if you're trying to inhale and tighten the pelvic floor. So do not inhale when you try to do a Kegel. And finally, number 5, the fifth most common mistake, you're exercising every muscle but the pelvic floor. Here's an example. You're really trying to do your Kegel, but you notice your butt is squeezing, your inner thighs are squeezing, you're feeling it in the low back. Those are all muscle groups that aren't part of the pelvic floor, and they're just helping out because the pelvic floor hasn't figured out how to work well yet. Try to keep those muscles more quiet. I hope that watching this video has given you the basic information you need on what a Kegel is and how to do it correctly if you're a guy. There are some subtle differences. What I'd like you to do next is I want you to practice. If you're able to, practice standing up in front of a mirror. If you're afraid about leakage, put a pad down on the floor or a towel or a puppy pad to absorb those leaks should they happen. Try doing the Kegel in front of the mirror. I want you to watch your posture, watch your abdominals, and watch what happens at the base of the penis and the scrotum. Those will all give you good clues as to, are you doing it correctly or not? If you've tried these suggestions and still have trouble and aren't really understanding how to do it, that's okay. I would suggest seeking out a pelvic floor physical therapist in your area or another similar healthcare professional who can give you that one-on-one guidance that you need to help really learn how to do this well so you can have the best recovery possible.